Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we'll talk with Dr. David Snow and physician assistant Kara Bailey at Cape Fear Arthritis Care. Then we'll meet Jason Honecker, a physician assistant who has joined Novant Health Oceanside Family Medicine in Bolivia. And finally, we'll meet Katie Campbell, also a physician assistant who has recently joined Novant Health Gastroenterology Brunswick. Stay tuned to learn about valuable health topics with HealthWatch. Our first guest today is Dr. David Snow and Kara Bailey of Cape Fear Arthritis Care. Well, welcome back today, Dr. Snow. It's such a pleasure to have you back.
Thank you, June. It's great to be back.
Well, good.
It's hard to believe it's been about 2 years since I was here last time.
That's right.
Yeah.
That's right. And you've brought Kara with you today, Kara Bailey, I believe, and you're a physician assistant?
I am.
In Dr. Snow's office?
I am.
She was an excellent find for our practice.
Well, good,
Yeah.
good. Well, let's talk a little bit about background, specifically education and such. So let's start with you, Dr. Snow. Tell our viewers where you went to school and your experience.
Well, I grew up in Central Ohio and went to school at Ohio University, home of the Bobcats. Not the Buckeyes, the Bobcats.
I know,
It's
that's where I
different.
went to school.
Yeah.
We're
Good. You went to? Oh, good.
Okay.
And went to medical school at University of Toledo, and then did my residency and fellowship in Pittsburgh. So I was there for 5 years for training, and then I worked with the hospital for 3 years, and wasn't really what I wanted, and got a opportunity to come to North Carolina and joined a practice in Wilmington in 1998. And we love Wilmington. We love the area. We love Brunswick County. And decided it'd be best for me to strike out on my own because I had kind of my own ideas about aches and pains and how I wanted to treat patients and what I wanted to do for patients. And so in May of 2014, we started Cape Fear Arthritis Care, and it's been a great experience since then. It's just been tremendous. We've been growing, and we're helping a lot of people, and we really enjoy it.
That's awesome. Well, Kara, how about you? How did you become a physician assistant, and why are you interested in arthritis care?
Okay. Well, I'm originally from Raleigh, so I've lived in Raleigh pretty much my whole life until I came to UNCW. So I went to UNCW for undergrad for 4 years. I absolutely loved the area. I mean, I knew I always wanted to go back. I went back home for a little while to get some hours for PA school because I kind of got interested in PA school, doing some medical missions and things like that.
Oh, yeah.
And then I went to ECU and I got in, which was really exciting. I did ECU for the 2.5 years, and actually did most of my rotations in this area in Brunswick County, with some with Novant actually. And I just had a great experience. So I was looking for rheumatology jobs specifically because I have rheumatoid arthritis myself.
Oh, I see.
So I was diagnosed when I was pretty young, age 8, and I've been dealing with it ever since. And so when I was in school, I sought to do rotations in those areas. So I did one in New Bern. And I just had a great connection with the patients. It was very personal.
Right.
So I really sought out to find a rheumatology position and didn't think I would actually find one. And when I saw the one in Delco, I was really excited. And so met Dr. Snow, and we just had a good working relationship ever since. So I've been really pleased to be in a specialty that I love and I'm passionate about. So.
And Kara, how long have you been with Cape Fear Arthritis Care?
So I came on when they moved to our brand new office in Leland. So that was in July this past year.
Oh, so let's talk about that brand new office.
Yes.
Now, you opened this office when?
July. We moved in July of 2015. So we've been there going on a year. Coming up on a year.
Wonderful.
Yeah.
Well, exactly where are you located?
We're in Waterford, and it's 1003 Old Waterford Way. And it's the last building before you get into the residential area. There's the big
Right.
medical building there. That's not us. We're behind that. Yeah, we got a kind of tucked away in a nice little office. Not a little office. I mean, we went from 1,200 square feet. Now we're over 5,000 square feet.
Wow, that's a big difference.
Yeah, we have lots of services.
Great.
You know, with Cara there, and we're doing ultrasound, which is kind of a new, relatively new technology.
Okay, well, let's kind of start with the basics.
Okay.
Tell me what a rheumatologist does.
Rheumatologists are physicians that specialize in the medical management of aches and pains. And classically, that was, we deal with rheumatoid arthritis, lupus, autoimmune conditions. That's kind of where our training is. But beyond that, I mean, everybody has aches and pains to some degree.
Right.
And my interest really is helping people deal with aches and pains. So we do the inflammatory stuff. We do rheumatoid arthritis and lupus. We also work with patients with fibromyalgia and osteoarthritis and specific pain syndromes. They may have myofascial pain, bursitis, tendonitis. So really, aches and pains. If you got aches and pains that are affecting your life on a daily basis, and you want somebody to take a look at it, and you don't want a surgical evaluation, I'm your guy.
I didn't know that.
Yeah.
That's very interesting. I would have thought aches and pains, you just go to your primary care, but for those that persist and go on and on and on,
Yes.
and you're popping the Tylenol and the
Yes.
might want to see a rheumatologist.
Yeah, I mean, that's where I like to position our office, which may be a little bit different than a traditional rheumatologist. I mean, many rheumatologists, they only want to see the patients who have already had positive serologies and have a definite diagnosis of an inflammatory arthritis. My interest is really more of that stuff, but also, you know, traditional or more of the common aches and pains like osteoarthritis, something that everybody gets to some degree.
So what kind of patients do you typically see? What types of patients?
You know, I don't think there's a typical patient. Would there be? We
Not really.
we have young patients, older patients. I mean, I think aches and pains are more prominent as we get older.
Right.
The peak age for rheumatoid arthritis is in 50s to 60s, so you know, tends to be older patients. But we see all kinds of, you know, knees, and we do some stuff with backs. I mean, we don't do surgery, so if we need to get somebody to the surgeon, we do that. But you know, not everything is necessarily surgical. I mean, sometimes, you know, helping people live with what they have is, you know, part of the process. I mean, sometimes it can't be fixed, and so coming up with a strategy for living better with the aches and pains that you have, and we work on some other planes such as mindfulness and acceptance commitment therapy. We introduce patients to other ways of dealing with their aches and pains, and you know, they may have the aches and pains, but do they have to suffer from it?
Right.
Yeah.
Well, Cara, you shared with us why you are interested in rheumatology, but how about you, Dr. Snow? Is there a story behind the?
Yeah, I mean, I grew up in and I have actually a picture of my grandfather and my father in the office because they're both doctors. My sister and my brother and sister-in-law are also doctors. A long line of
a lot of doctors in the family.
A lot of doctors in the family, and so I kind of knew I wanted to do medicine, but I've always liked musculoskeletal medicine. But I'm not a surgeon. I don't like being in the OR. I don't like being in a position where, you know. I'm not sure exactly what to do next, so I'll be back in a week. You can't do that in the OR, you know. And with patients, you can say, well, you know, let's try some things and move forward. And I like that flexibility. And I like musculoskeletal medicine. I had a good mentor in residency who's a rheumatologist that kind of piqued my interest.
Now, do the two of you work as a team, or do you have patients of your own, or how does that work, Cara?
We generally have patients as a team. We try to actually alternate patients if at all possible. For brand new patients, we try to see them together so that we can establish care. But we like to be on the same page with most patients, so we don't do it in a very structured way, but usually it's kind of, you know, whoever saw the patient last, let's have you see them so that everyone's on the same page.
Sure.
And that works out pretty well, I think.
Yeah, it seems like you have a good process going there and that it'll be comfortable for both you and the patient.
Yeah, we don't, you know, I really want to focus on the teamwork, and actually it's nice to have Cara. I mean, she puts a different perspective on things. So, you know, and so we're actually both working together to work on the patient's problem. And she, you know, if you're just doing things by yourself, oftentimes you don't think of something, and so it's nice to have that input.
Yeah, it's good to bounce it off of somebody else.
Yes.
That's
Yeah.
great. Well, can you share with our viewers how they might reach your office if they'd like to schedule an appointment or just have a conversation? Maybe they're not sure they need an appointment or whatever. What might they do, or how might they contact you?
They can call our office. Our phone number is 379-3212, and our website is www.cfac.co, not com.co. The person who does the scheduling is my wife, Daphne, and she has a pretty good idea of what is the appropriate patient. So they can certainly talk with her. Usually, it's hard to get a feel for over the phone.
Sure,
so
it is.
If you're taking medicines on a daily basis and you're having some aches and pains and you're not sure what to do next, it's better just to come in and take a look.
Absolutely.
And see if we can put something together.
Great.
That usually works the best.
Great. Well, it's been wonderful having both of you on the show today, and I look forward to the next time, and we'll talk about arthritis in more detail.
Okay, that sounds great.
All right.
Thanks you so
again.
much.
Thank you.
Our next guest is Jason Honecker of Novant Health Oceanside Family Medicine in Bolivia. Hello, Jason. What a pleasure to meet you.
It's a pleasure to meet you, too. It's nice to be here.
Well, we're so glad to have you on the show and in our area.
Thank you.
And so I'm curious, how do you like the area so far?
The area's actually been great. We really like being near the beach. It's a little bit different pace of life than my wife and I are used to, but it's been nice kind of slowing down a little bit, and it's been great.
Yeah. Well, let's get to know you a little better. Tell me about your education and your experience.
Sure. I did my schooling in Virginia. I grew up in southeastern Virginia, and so I did PA school at Eastern Virginia Medical School. And then I've had a couple different areas of work since then. I worked in neurosurgery for a couple years in the OR in a hospital. Then I was a family practice PA at a military treatment facility as a civil contractor. And then I moved to New York City and worked in a private practice pain management clinic. So I've had a lot of different experiences.
A lot of different experience, and that's really good and good for us. I understand that you speak Spanish, is that correct?
Yes. So in New York, a good percentage of my patients are Hispanic. So I was frustrated with having to get an interpreter all the time, so I started taking Spanish classes so I could learn.
Well, that's great. It'll probably come in handy in this area, too.
I hope so.
Yes. Well, I'm curious what led you to come to this area?
So mostly, the short answer is family. We have family in this area. We didn't in New York. The longer part is that my wife and I traveled for all of 2015 and basically spent all of our money. And
you had to go back to work.
Had to go back to work, and we wanted to be nearer to family, so here we are.
So you've always had family here, and had that always been your plan to come back?
No, it's actually been more recently. As I said, my wife and I both grew up in Virginia, but we've recently had family moving to this area. So everyone's kind of moving down this way.
Yeah, it's kind of nice when you have family in the area and
It is.
just like coming home, So
Absolutely.
that's really
good.
good.
And it feels like home. It's similar climate and near the beach, so it's been great.
Well, let's talk a little bit about the practice. I know you're at Novant Health Oceanside Family Medicine in Bolivia. Is that correct?
Yes.
And you're partnered with Dr. Kenneth Hamby?
Dr. Hamby, yes, ma'am.
Yes, he's a great fellow. We've had him on the show, too.
He's great. I've seen the video.
Oh, good. What services are you offering at that location?
Sure. Well, being family practice, we have typical annual exams, routine screening.
Sure.
We see a full range of ages.
Okay.
Plus sick call, as well, same day.
So do you see infants?
No, really, kind of basically like 2 years to 100.
Okay. 2 to 100.
Right.
Well, that sounds good. I think that's kind of nice because you build that relationship within that family, and
Correct.
so that makes it kind of nice. As a physician assistant in the office, tell me more about your role in the group.
Sure. It's a busy practice, so
Yes.
kind of where I've been fitting in so far, and I've been here about 2 months, is sort of freeing up Dr. Hamby to start seeing new patients and making his life a little bit easier. So all of our same-day patients that need to be seen, people who are sick and would like a quicker appointment or have an issue where they normally would have to wait several weeks to get an appointment, are able to come in much more quickly to get a visit.
What are your hours at the clinic?
So right now we're 8 to 5, and we're going to be going 8 to 6 within probably a month.
Yeah, many of the practices are open until 6, and I think that's a real people pleaser because people who work, can't always take time off.
Yeah, it can be hard to get an appointment that
way.
way.
Right. Now, at Novant Health, as in most of the Novant Health medical groups, they use electronic medical record.
Yes.
And I assume that you also are on that record?
We are.
Yeah.
Yes, ma'am.
And how's that working for you?
It's great. It's always a little bit of a transition getting used to a new system, but I really like the one that we're using. It's integrated really well with some of the other physicians in the area, and we're able to communicate with patients very effectively.
Do your patients like MyChart?
They do. It's great. They can send us messages, and we're able to respond back to them, and we can send them their lab results, test results on MyChart, so they are able to go on, and it frees up some of our staff from not having to make as many phone calls, which is great.
Yeah, I love MyChart. I think it's great, and it's refreshing to be able to email your physician and get that response.
Absolutely.
It didn't cost you anything.
Right.
It didn't take any time, and it's
patients really seem to like it.
Yeah, I think it's really a good thing. Well, for viewers out there who might be interested in coming into the office, how might we get in touch with Novant Health, Oceanside Family Medicine in Bolivia?
Sure. There's a few different ways. We're located at 584 Hospital Drive, Suite C, right next to the Brunswick Medical Center on 17. So they can find us there.
Very convenient to the hospital.
Absolutely. Yeah, it's really great having it right next door. They can also reach us by phone. It's 910-721-4100, and also online, NHOceansideFamilyMedicine.org.
Oh,
so a few different ways they can track us down.
Sure. Great. Is there anything else that you would like to share with our viewers before we wrap up?
I'm excited to be here, and I'll be seeing a lot of patients, as people like to be able to get an appointment quickly. So it's nice to be able to have that option. And Dr. Hamby and I work very closely. We try to treat our patients like family, and provide the best care that we can. So I'm sure I'll be seeing some of our viewers, hopefully,
That'll be great,
soon.
and I'll tell you that they saw you on the TV show.
That'd be awesome.
And you are accepting new patients, correct?
We are, correct. We're getting through a lot of new patients now that have come on board. So Dr. Hamby usually sees the new patients, and then follow-ups we'll both take care of.
Great. Well, thank you so much for being here today.
Thank you for having me.
It was a pleasure to meet you.
It's a pleasure meeting you as well.
And I'm happy that you're enjoying the area. And I hope we'll have you back sometime soon so we can see how it's going.
That would be great. Thank you.
All right. Thanks again. Our final guest is Katie Campbell of Novant Health Gastroenterology, Brunswick. Welcome to the show today, Katie.
Thank you.
It's such a pleasure to have you here on the show, and I'm excited to get to know you a little bit better. So let's get started, and let's talk a little bit about your education. Where did you go to school?
Well, I went to UNC Pembroke for my undergraduate. I received my bachelor's from there. And then from there, I went to Wingate University and received my master's in physician assistant studies.
Wow, that's a great school, and it's so pretty out there.
Yes, it's beautiful.
Yeah, it's a beautiful little campus. I really like it. How about sharing some work experience with us?
Well, I am fresh out of school. I graduated in December of 2015.
Wonderful.
And so I haven't really gathered too much experience, but in PA school, I completed 10 rotations in various specialties.
Such as?
I did pediatrics, I've done cardiology, I've done primary care to OBGYN, so it pretty much ranged from a lot.
Wow, that's good. You're so well-rounded.
Thank you.
That's a really great.
I hope so.
I think you'll be great in this area. And speaking of area, what led you to come to our area?
So my husband, he is a real estate broker for National Land Realty. Yeah, so they deal very heavily in the southeast portion of the state, and so we came here, just wanted to check out, the area, and we ended up loving it, so we stayed, and we could not be happier. We love it here.
Well, that's good to hear. Do you live near the water?
Unfortunately, no, but we are moving closer to Oak Island here soon, hopefully.
Oh, really?
Yeah.
So you guys are enjoying the area, and do you like water sports? And do you like?
Yes, yeah, we love to be out on the water. We love fishing. We love, jet skiing and
Wonderful.
all things water related.
Good. Well, on Oak Island, you'll have lots of opportunity to enjoy that water.
Yes.
Well, tell me a little bit about your partners at Gastroenterology Brunswick.
Sure. So Dr. Lamphere, he has many, many years of experience in GI. He's very intelligent. He's a great educator. He educates both myself and the other PA, Miss Ghana, who is extremely intelligent herself.
She's been on our show too.
She's lovely. And so he's really good with educating his patients as well.
He
and
is.
I just strive to be like him and Miss Ghana. So hopefully I can absorb everything that they're teaching me and kind of, relay it to my patients.
That's wonderful to hear, and I'm also a patient of Dr. Lamphere's,
Oh, awesome.
and so I can attest to that, his willingness to educate and talk you through things. He gives the patient every opportunity to learn about their condition and what's best for them. So.
Yeah, he's extremely educational.
Yeah, I love that practice. Let's talk about some of the services that are offered at that location.
Sure. So a lot of the procedures that we offer, like the upper endoscopies, colonoscopies, barium enemas, fecal occult blood tests, those things are done at Novant Brunswick Medical Center. So and they're all under Dr. Lamphere's supervision. So he's the one that performs all of those procedures. Things that we do inside the office would be like a digital rectal exam, a physical examination, but most of the procedures that we offer are at the Novant Medical Center.
Great. Let's talk about some of the specialized procedures that he does, such as the colonoscopies and what have you. How do patients feel about that? Have they had good experiences?
Yes, so far I have been doing some screening colonoscopies with some patients this week, and so far I really haven't heard anything bad from the procedure. He's very delicate during the procedure. He takes into account a patient's privacy, and it's very what's the word I'm looking for? Patients trust him, so they have great experiences with him. They begin at 50, maybe earlier, depending on your family history of colon cancer or polyps. But most of them begin at 50 and then occur every 10 years if you have a normal colonoscopy. Until typically around the age of 80.
Oh, really?
Yes.
So I can look forward to that.
Once a patient turns 80, then we kind of weigh the risk versus the benefits and things of that sort.
And then if they have a condition that might warrant them to be more frequent, you could have them, every 3 to 5 years?
Every 3 to 5 years, depending on what in that family history or what in that personal history that actually has occurred.
Well, as a physician assistant in that practice, what's a typical role that a physician assistant would have there in the office?
So we basically do the same thing that Dr. Lamphere does, except for the procedures. We see the patients that come in who express GERD symptoms, who have irritable bowel symptoms, inflammatory bowel disease, diarrhea, constipation. We see a whole range of things. So we serve the same purpose that he does. We act in that same role. We see a ton of different things on a day-to-day basis, just except for the procedures.
So if a patient feels like they need to see someone, they would call and make an appointment with him and then likely be seen by you also.
Right. If the patient calls and they request, Dr. Lamphere, then our secretary would try to make it as possible as they could to put them on his schedule. But if he's off a day, or if he's just too busy, or if he's in the hospital, then they can see us if they would like.
Oh, that's good to know.
Yes.
That way there's coverage all the time.
Especially with 3 of us now, hopefully we can better serve supply and the surrounding areas.
Sure, yeah. Well, before we wrap up, tell our viewers how to get in touch with you and with Novant Health Gastroenterology Brunswick.
Sure. They can visit NH Gastroenterology Brunswick at org, or they can call the office 910-754-5988.
5988. And we'll put that on the bottom of the screen too, so that viewers
Okay.
will have another opportunity to give you a call. How about referrals? Do we need a referral to get in to see Dr. Lamphere?
Most of the time, yes. So if a patient's primary care physician or their provider is really unable to further manage their symptoms and control them, then they would refer them to us.
I see.
And hopefully we would be able to further manage them with a necessary procedure or something like that, if it were indicated.
Great. Well, is there anything else that you would like to add today before we close?
I don't believe so.
Just that you look forward to seeing
Yes,
patients in your office.
absolutely.
Great, great. Well, thank you so much for coming today.
Thank
It's
you
been
for having
a
me.
pleasure to meet you, and I wish you the best.
Thank you so much.
Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit novanthealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
Stay connected with your community channel. Like ATMC TV on Facebook today.
At ATMC, we get it. We know you'd rather spend your time surfing, tweeting, gaming, and checking out your favorite sites. It's important to stay connected to those who matter most. That's why we're here. ATMC. Local company, local priorities.
Ever wonder why your local TV bill keeps going up? The bulk of these increases are due to rising network fees. A few powerful media companies dictate what TV providers must pay to offer their channels to you. And every time networks demand more money, that affects what you pay every month. If TV providers don't meet their demands, networks threaten blackouts. Since 1999, these network fees have increased by 3.5 times the rate of inflation. To see what we're doing to keep network fees in check, visit tvonmyside.com.
We are ATMC TV, Channel 3 and HD Channel 910, your community channel.